really minimizes fear. And when you feel frustrated, try to ground yourself with these three things. First, the facts. Like the facts, like knowing credible facts might really help. It minimizes fear, as I said. The second, try to communicate your feelings. Speak about it with people you trust, people who listen to you without judgment. Try to get connected with your family. Stay connected with your family, be it with technology or anything. Try to stay connected. Don't lose that connection. It might be your anchor. And also, in addition to that, give your benefit of the doubt to the super being. Pray. This might help you be grounded and feel at ease so much. So teeny tiny activities might help you prevent or might help you from having all those mental health issues. And as I said earlier, mental health is one of the biggest worrisome things that needs to be addressed. It's also the public health response of every epidemic, every pandemic. And if you don't prevent it, you're going to be scarred and have a post-quarantine or a post-corona mental health issue as well. So might as well prevent it from here on. And also, take breaks, take care of your family. And for those of you who have children or teens at home, please do talk to them and really attend to their changing behaviors if there is any. And when you do talk to them, please tell them the facts. Get the facts straight with those people, because they easily overanalyze and they easily overestimate things and tend to get overly worried. So we don't need that to happen. You need to get the facts straight with children's at home and answer all their questions, address all their worries as well. Talk to them, please. Just give time and really talk to them. And also, kids tend to watch how the adults around them react. So try to be calm and very reasonable when you approach things about this issue, okay? Also, recognize your feelings, your thoughts, your actions. Keep track of those things. Why am I thinking in such a way? Try to analyze things. Try to think things reasonably. Is there a way I can prevent this? And why am I not doing that instead of worrying? Try to keep track of those things, okay? Why am I feeling unwell today? Why am I feeling disturbed today? Those are the things we need to really ask ourselves and dig deep into our thoughts so that we can reassemble those thoughts into something reasonable. And added to that, I want to address something about worry. Whenever you're worried or frustrated, try to classify your worries into two. Worries that you can do something about and worries that you can do nothing about. So when speaking of worries you can do something about, for example, regarding corona, washing your hands, social distancing, isolating yourselves from the public, and keeping safe, eating healthy. There's things we can do about, right? These are things we can do, so might as well not worry and do these things. And for those of our worries we can't do anything about, it's out of your league, it's out of your power. You can't do nothing about it. For example, for a person who's already contracted corona, yes, he might add supplemental foods, he might eat healthy, he might get the treatment needed, but the prognosis or how it's going to progress is out of his power. So might as well give some worries that we can't control or do anything about to the super being, to God. Might as well pray and make ourselves feel at ease. Give the benefit of doubt to God. But while doing that, address the worries that you can do something about by doing something instead of worrying. Because doing something pays. It will prevent you from contracting the illness, but worrying doesn't. It adds up to your mental health issue. So better minimize the worry part and increase the do and the faith part, where we give it what we can't do nothing about. And the second question is about the media coverage. How much should we expose ourselves to the media, as it commonly? So regarding that, we need to find a healthy balance. of media, as to not expose ourselves or ever overwhelm ourselves with negative news, but to stay informed at the same time. I mean, watching it once or twice is good. Watching it from a commendable source, from a reliable source, as that of the WHO, is good. But overly watching news all day is bad for all of us. It's not good for anyone. So limit your media exposure. Make sure to stay informed, but not to overwhelm yourself with negative thoughts. So, and 1-2 trustable sources are enough. You don't have to go through all news sources to find out about this thing. Some are fake, some are false news, some are false feeds, and we don't need to overwhelm ourselves with such things. And also, as I said, change the narratives. All media tend to talk about the number of deaths, the number of people who have already contracted the disease, but we also need to address the number of recoveries. We really need to. So might as well change your perspective or narrative of seeing things. That will really help on coping. That in the final question, what can we do about this as a whole? What we can do about this is address the mental health, do social media campaigning about mental health. It's not just you and me going through this, it's the whole world. We need to make sure, we need to let them know that they are not alone. Nobody's alone in this, we're all together. So do social media campaigning about mental health, and we also need to have a phone service for those who are in quarantine regarding to addressing their mental health in addition to addressing their physical health as well. So we need to do those things. Also for the healthcare staffs, they are in constant fear of contracting the disease, so those people need to be addressed, and if there is need of help, maybe seeking a mental health support for those healthcare staffs is also very much appropriate, as they're the frontliners and the most at risk for this disease. So phone-based services to those who are in quarantine, to those who are outside, overwhelmed with worry, to those with mental health issues previously contracted. For those, we can at least provide phone-based support to help them be calm and be very, to take a calm and practical approach in order to combat this illness. And also, in addition to that, we need to integrate mental and psychosocial support to every treatment that's given regarding corona, because mental health is one of the biggest public health response to this COVID-19 as well. So let's all try to stay calm, let's all try to get our facts straight, let's all stay informed, and also inform our relatives who tend to be misguided and overwhelmed with worry. Let's try to be there for one another, and also try to stay grounded by the 3 tips I previously mentioned, getting credible facts from reliable sources, and also in addition to that, we can also talk to the people we trust that will just listen to us without judgment, and most of all, pray to win this epidemic with victory, with as much as people as we can, and look at it from a very positive perspective. Let's spread positivity, because negativity tends to suppress our immune system as well, in addition to contracting those other mental health issues. So let's avoid all those negativity, let's change our narratives, let's be together in this. That's the only way we can